Welcome to Sustainable Health Empowerment's Health Education Series. I'm Brandon Willis, a fourth-year medical student with St. George's University School of Medicine. This is the first in our four-part series on hypertension. In today's session, we will understand what blood pressure measures, what the numbers mean, and define hypertension. In our following episodes, we'll discuss causes, risk factors, and treatment. So let's jump right in. Our objective for today's episodes are to understand the dangers of high blood pressure, understand the meaning of blood pressure readings, and define hypertension. What is high blood pressure? High blood pressure, also known as hypertension, is a serious condition that can lead to the following health problems: coronary heart disease, coronary artery disease, heart failure, stroke, kidney failure, and other health problems such as vision changes. Blood pressure is the force of the blood pushing against the walls of the arteries as the heart pumps blood. If this pressure rises and stays high over time, it can damage the body in many ways. High blood pressure usually has no symptoms. A person can have it for many years without knowing it. During this time, however, high blood pressure can damage the heart, blood vessels, kidneys, and other parts of the body. Let's understand what we are measuring when we take a blood pressure. The systolic or upper number measures the pressure when the heart is pumping. The diastolic or lower number measures the pressure when the heart is at rest. 120/80 or lower is the target blood pressure. Keep that in mind. This table shows normal and abnormal blood pressure numbers for adults. As you can see, you are likely to be diagnosed as hypertensive at some point if your numbers are between 121/81 and 139/89, and you are definitely hypertensive if your blood pressure is 140/90 or higher. Blood pressure doesn't stay the same all the time. For example, it lowers as you sleep and rises when you wake up. Blood pressure also rises when you are excited, nervous, or active. If your numbers stay above normal most of the time, you are at risk for health problems. Blood pressure numbers. All levels above 120/80 raise your risk, and the risk grows as the blood pressure numbers rise. Prehypertension means that you're likely to end up with high blood pressure unless you take steps to prevent it. If you are being treated for high blood pressure and have repeated readings that are in the normal range, your blood pressure is under control. However, you still have the condition. You should see your doctor and follow your treatment plan to keep your blood pressure under control. If you have diabetes or chronic kidney disease, high blood pressure is defined as 130/80 or higher. High blood pressure numbers also differ for children and teens. Let's see what we remember of what we have learned. What is considered a normal blood pressure for adults? Less than 120/90, less than 130/80, less than 100/80, less than 120/80. I think we know what the answer is. Less than 120/80. Blood pressure is the force of blood pushing against blank as your heart pumps blood. Capillaries, the walls of the arteries, the skin, heart muscle. If you answered the walls of the arteries, you would be correct. High blood pressure usually has no symptoms. True or false? I think we know what the answer is. If you answered true, you would be correct. This is a multiple choice question, so more than one answer may be correct. High blood pressure can lead to which of the following health problems? Kidney failure, vision problems, influenza, heart failure, pneumonia. If you answered kidney failure, vision problems, and heart failure, You would be correct. People who have high blood pressure can take steps to control it and reduce the risk of related health problems. Key steps include following a healthy lifestyle, having ongoing medical care, and following your treatment plan. Today we learned what hypertension is and the damage that it can do if left untreated. Over the next 3 sessions, we will explore causes and treatment of hypertension. But I'll bet you can already guess some of the things that can lead to high blood pressure or make it worse. What we call modifiable lifestyle changes. That is, behaviors that we can change. What could they be? If you guessed any of these diet, weight, smoking, alcohol, stress, and exercise you're right. So before the next program, think about which of these you really need to improve and set goals for yourself. Thank you for tuning in, and be sure to check out this episode and all the episodes in this health series on Khmer TV. We'll see you next week. Here's to good health and good habits.